Good evening everyone, how are you? Hope you're doing good. Today I am going to talk about one of the important topic, that is malaria chemoprophylaxis. Let's go into the topic. Regimens for malaria chemoprophylaxis includes primarily the three drugs, atoquone, proguanil, doxycycline. These drugs can be used in all the areas, and mefloquine, which can be used in areas with mefloquine sensitive malaria. So other options are chloroquine or hydroxychloroquine, but their use is restricted to the few areas with chloroquine sensitive malaria. And primaquine or tafenoquine for short duration travels to areas with principally P. vivax infections. So in general, dosing should be started before exposure, ideally before the traveler leaves the home. In those few areas where the chloroquine sensitive strains of Plasmodium falciparum are found, the chloroquine is still suitable for chemoprophylaxis. In areas where chloroquine-resistant malaria is endemic, then we can use mefloquine and atoquone proguanil. They are the regimens of choice for chemoprophylaxis. For chemoprophylaxis in long-term travelers, chloroquine is safe at the dose used, but some recommend yearly retinal examinations, and there is a finite dose limit for which chemoprophylaxis with chloroquine is recommended because of its ocular toxicity. Mefloquine and doxycycline are well tolerated. Mefloquine is the best documented drug for malaria prophylaxis in long-term travelers, and if it is well tolerated, it can be used for prolonged periods. Atoquone proguanil has been studied for prophylactic use up to 20 weeks, but probably it is acceptable for years based on experience with the individual components. Let's talk about the individual drugs. First drug is atoquone proguanil. It can be used as prophylaxis in all areas. What is the adult dose? Adult tablets contain 250 mg of atoquone and 100 mg of proguanil hydrochloride, and one adult tablet orally can be taken daily. So the comments are, they should be started 1 to 2 days before the travel to the malarious areas and take daily at the same time each day while in the malarious area, and for 7 days after leaving such areas. What are the contraindications? It is contraindicating the patients with severe renal impairment with a creatinine clearance less than 30 ml per minute. It should be taken with food or a milky drink. It should not be recommended for prophylaxis for children weighing less than 5 kgs, pregnant women, and women breastfeeding infants weighing less than 5 kgs. Next, I'm going to talk about the drug chloroquine phosphate. Prophylaxis in areas with chloroquine-sensitive malaria. So what is the adult dose? 300 mg base, which is also 500 mg salt. It can be taken orally, but once per week. What are the comments? It should be started 1 to 2 weeks before the travel to the malarious areas, and it should be taken weekly on the same day of the week while in the malarious areas. And for 4 weeks after leaving such areas, this drug may exacerbate psoriasis. Next is hydroxychloroquine sulfate. It is an alternative to chloroquine for prophylaxis in areas with chloroquine-sensitive malaria. So adult dose is 310 mg base or 400 mg salt. It can be taken orally once per week. So what are the comments? It should be also taken 1 to 2 weeks before the travel to the malarious areas and take weekly on the same day of the week while in the malarious area, and for 4 weeks after leaving such areas. Next drug is doxycycline, which can be used as prophylaxis in all areas. Adult doses 100 mg orally taken daily. And what are the comments? Begin 1 to 2 days before travel to the malarious areas and take daily at the same time each day while in the malarious areas, and for 4 weeks after leaving such areas. What are the contraindications? This is contraindicated in the children less than 8 years of age and pregnant women. Next drug is mefloquine, which can be used as prophylaxis in areas with mefloquine-sensitive malaria. Adult dose is 228 mg base, which is 250 mg salt. It can be taken orally once per week. The comments, it should be also started 1 to 2 weeks before travel to malarious areas. Take weekly on the same day of the week while in the malarious areas, and for 4 weeks after leaving such areas. Mefloquine is contraindicated in persons allergic to mefloquine or related compounds like quinine and quinidine, and in persons with active depression, recent history of depression, generalized anxiety disorder, psychosis, schizophrenia, other major psychiatric disorders or seizures. It should be used with caution in persons with psychiatric disturbances or previous history of depression. It is not recommended for persons with cardiac conduction abnormalities. Next drug is primaquine. It can be used as prophylaxis for short duration travel to the areas with principally Plasmodium vivax infection. Adult doses 30 milligram base, which is 52.6 milligram salt, can be taken orally daily. The comments: it should be started 1 to 2 days before travel to the malarious areas. It should be taken daily at the same time each day while in the malarious areas, and for 7 days after leaving such areas. And it is contraindicated the patients with G6PD deficiency and during pregnancy and lactation, unless the infant being breastfed has documented normal G6PD level. Next drug is tafenoquine. It can be used as prophylaxis for travel to all the areas. The adult dose is 200 milligram daily before travel, or should be taken weekly during the malarial period and after the travel. So comments: begin daily dosing for 3 days before travel to the malarious area, then take weekly during the travel, starting 1 week after the last pre-travel dose. Then the final dose should be taken 1 week after the travel. It's contraindicated in people with G6PD deficiency or unknown G6PD status, pregnant women, women breastfeeding in infant with G6PD deficiency or unknown G6PD status, and people less than 18 years of old, or people with history of psychotic disorders. Thank you so much for your kind attention, and kindly share my lecture to your friends. Thank you so much.